Good evening to all the viewers. Welcome to IGCP Chat Show on new insights into cough management, the safe choice for children. I am Dr. Shweta Ghadge from the Scientific Services team of USV. Cough are the most common symptoms of childhood illness. Children can cough several times a day or have coughing episodes lasting up to a few weeks if they have viral infections. The current management for cough is not thought to be particularly effective and may not work in all cases. To discuss the impact of cough in children and newer therapies for cough management in children, I welcome Dr. Ajay Gambhir sir, who has been a part of the National Technical Board of Nutrition at PBPO, member of NTAGI from 2000 to 2018, member of the Delhi Medical Council and Quality Council of India. He's been the president of NNF, IAP as vice president and academic in charge of IMA headquarters. Welcome, sir, and thank you so much for joining the chat show today. So, sir, like I mentioned that that the cough is the most common symptom of childhood illness. So, what is this effect of cough on the quality life of children and the impact that it has on the parents?
I think very nice and simple question. Uh, we almost 40 to 50% of the preschool children, they report to us with a cough, and cough is irritating to the parents. It is distressing to the child, and it is irritating to anyone who is doing that, uh, attending the child. Moreover, the child stops taking the feed with the cough, and he may have fever with that, or he may have a vomiting. So it definitely impacts my daily activity and especially the quality of life of the child and the caregiver, including the parents. And because it makes a sound. And if you see the psychology, God has given us the sound, and so that the parent should attend the child psychologically. So it does have a psychological impact also, along with the physical impact and the emotional impact.
Yes, so sir, there is cough which is common, and also that it has a psychological, physical, and social impact on the children as well as parents. So, sir, now focusing on the management, since it is such a distressing situation for the parent and the child, what are the issues with the current management for productive cough in young children?
See, first, let us remind everyone, and we should not forget the normal. That is uh, what is physiology. The physiology is that it is a protective mechanism, and it is a protective mechanism, and it is also a warning sign. Why it is a protective? Because the God has given me so sensitive respiratory tract from the nose. As soon as anything enters my nose, I start sneezing, discharging, and or coughing. When it goes into the throat or the trachea, I start coughing. So my voices and noises will be different, whether it is upper respiratory tract or mid respiratory, or it is a lower respiratory. So it is a physiological God has given us so that I should clear my respiratory tract. If I eat, I don't cough. But if any foreign particle, any virus, any foreign body goes, I start coughing. So one is that the coughing is a protective reflex, and it has very balanced phenomena. Like it has got a chemoreceptor, it has got a mechanical receptor, it has got a pressures, and thus all my afferent waves, and then the efferent, it goes to the medulla. So the cough reflex is the most strongest reflex in my body. So all parents, all caregiver, and all medical person should understand that God has given us cough, and till I'm awake or till I don't die, the cough will be there. So it is most important protective reflex. So I should not suppress the cough. I have to only modify the cough and to see that what is causing cough so that I can treat the cause. And that is why we have understood. And most of the people which are taking self treatment and the syrups which are available in the market, the warning has been given for the adults and the children also, that if they take extra dose or a more dose, it will cause sedation, because cough reflex coming is from brain. So brain is an active part of my cuff reflex. So afferent nerve, efferent nerve, muscles, my diaphragms, these are all the part of the cuff reflex. So what cuff, the causes may be very different, uh, and most of the children under 5 have a dry cough. But what the term we use it, because child do not do expectoration, so what we define it as a productive cough. Once the child has a secretion, the sounds are there, because child respiratory tract, the diameter and radius is less. And we have read in science and physics, if the radius is less, resistance is more. So once I have a productive cough with secretions, they stay back, because child is unable, child does not have much muscle power to cough out and expectorate. They stay in the lungs, and they cause infections, and they cause pneumonias, and they'll cause further problems.
Yes, so sir, like absolutely correct that it is a reflective, it is a mechanism, protective mechanism from the body. But sir, and that suppression is not the answer. You need to cuff out. So here, sir, the current management, being of multiple medications that are given and not showing really the effectiveness that it needs. Now we have a dried ivy leaf extract cough syrup, so which is showing all the properties that are beneficial to the children. So, can you highlight some of the properties of dried ivy leaf extract, especially in productive cough in children?
Yes, before that, what I was telling, that people are using cough syrups or expectorant right, left, and wrong, and they are self-medicating it. And that is why we have seen sedation side effect, and a lot of issues with the cough syrups, because when syrups are required, they give expectorants, and when expectorants are required, they give other bronchodilators. So definitely there was a need, and most of the time in practice, I have seen that 1, 2, or 3 days cough, whether we call it grandma treatment or a mother treatment, they will use it any drug which is available with them, and all drugs have a medications, different medications from histaminic to anti-allergy, so it will have side effects. So, and we have seen during COVID and otherwise, that the child needs something much better than what is available in the market. And for this, the ivy, the leaves which are dry ivy leaf extracts which are available, uh, are handy, and they are good. And now, which I did find out, that initially which available in the market as a scheduled drug, and recently been allowed as a OTC, because the drug controller finds it quite safe and quite effective. And the benefit of the IV extracts what are seen are, they have a lot of properties, and the properties are starting from the uh, antitussive properties, to anti-allergic properties, to the antiviral properties, so which and so anti-soothing properties. So they are very effective in the different conditions. And most of the cup we have seen and now we have found are the viral, maybe in the form of rhinosinusitis or laryngobronchotracheitis with a mild one, or viral induced cough which lasts for 1 week to 2 weeks, which can easily be given. So these products, and there is a lot of research going in the CDC and the especially in the German market, that these what we call is the alternative medicines. The government of America and CDC is promoting all those drugs and extracts which we get from the plants, which are natural and they are more beneficial to us rather than the artificial chemical which we are putting in.
Yes, so yeah, agreed that dry ivy leaf extract cough syrup has the added benefits of the extract, and it helps in multiple indications also of how cough as a symptom can cause. Here, sir, since you mentioned about the conventional treatment available and they have multiple side effects, and but dry ivy leaf extract does not. There are studies which support that it does not have side effects, and so the DCGI recently did give the approval for it to be claimed as a OTC product. So this is something that it is very important for the audience also to understand that the current medications are being utilized, but there is always a safety aspect which creates a sort of caution. And here, when dried ivy leaf extract cough syrup is used, because of the safety data that it has, it can be effectively used in the productive cough in children. So, sir, since we are comparing it with the available brands, how effective is ivy leaf extract as compared to the available treatment for treating productive cough in children?
Before I go to comparison, the in last 5 years, our understanding of the cough has improved, and the cause. You did raise a question initially. The cause. The cause we are finding are mainly viral and allergical. And I'm not talking about the cough due to pneumonias and cough due to foreign bodies. Those are the different classes. Most of the cough in the OPD are allergy. And say in Delhi, from where I'm speaking, March, April, and May during Baisakhi time, this is the time of allergy, and we see a lot of cough, mild cough from the grass pollen or from the tree pollen, other thing. And seasonal allergies are definitely low. And along with that, there are itchy eyes and all that. So the issue is, I I told you earlier that we don't have to suppress the cough because God has given us cough for removal of the secretion. We
Hmm.
have to see the cause. And
Hmm.
with the mild cough and appropriate treating of the cause, we need a very mild antitussive broncholytic and which has a thing. So what happens? There is no combination available for children. Either we give CPM or we give phenylephrine. So what happens? They definitely have a suppressions or they have a side effects of sedations and they have a other side issues. So definitely we were looking and the rest of the depending upon the productive clubs whether you have the nose discharge or it is a post nasal drip. Lot of preparations are available in the market and some of them are good. But now a lot of preparations are there in the combination and which makes things very very complicated and people use it as a OTC product. And what we have seen with the product which has been introduced with the Ivy Leaf was that it is acceptable, it is safe, it is acceptable, and it is effective. It is effective also. So that is why we start giving these type of drugs which are available to us, which has got a minimum side effect and maximum effectivity and maximum acceptability also.
Correct. So, right, sir. And here, very important for the audience to know that even though multiple medications are available and combinations that sir spoke of, there are combinations available, but all of that have some or the other side effects linked, and also the issue or and caution from the doctor's perspective of whether it will work in children, whether it will be safe to be used in children, is something that is always a worry. And with dry ivy leaf extract cough syrup, all of that is proven, and there is literature supporting of how effective and safe this cough syrup is for children. So, sir, here we would also like to understand, since you're mentioning about productive cough and symptoms that it can take care of, can it also reduce the other symptoms that occur in respiratory infections?
So, definitely it does. And as you have digoxin and aspirin, which we got from the plant alkaloids, and they are still going strong with the cardiology. So this is the drug. We find that it got a alpha heterin, and which is derived from saponin. It prevents, and it prevents beta 2 adrenergic receptors, which are on the surface of the bronchial smooth muscles, and in alveolar cell type 2 cell being inactivated, and leading to a higher number of receptor being activated, and controlling and releasing endogenous adrenaline for the greater bronchodilation and surfactant like in fact things. So it acts as a secretolytic, it acts as a small expectorant, and also antitussive. We don't need a very strong expectorant, because the child do not do much of expectoration. If we give strong expectorant, they will keep on coughing, and so it has both expectorant and a antitussive response. So if the drug is available to us, which is directly being sourced from the plants, and it is safe and accepted by the body, so that is the best we have to use it. Because the issue is, in 50% cases which are reporting to us, they have a fever also. So there are a lot of drugs available in the market with antitussive and crocin, or whatever it may. So people sometimes start using those things because of giving less of medicine. But I don't think so. Till you have a fever, we should add any antipyretic to it. So any cough without fever, if it is with fever, then we have to add part of a crocin or anti other uh, antipyretic. Otherwise, it is good enough to control it. And studies have been there from children as less as 6 month age. Now the preparations are to go at the adolescent and also to the older children also.
Yes, agreed that, sir, it works wonderfully in children less than 1 year of age also, and also in older children and adults. So, and sir correctly mentioned that, combinations today are available to, and if even if antipyretic is not required, it is something that is given for treatment of viral infections. And here the ivy leaf extract cough syrup can help reduce the cough and also take care of other respiratory symptoms.
So can I add? So in brief, we have gone more pharmaceutically. So in a brief, so it has got a good mucolating activity, it good a bronchospasmodic, cough relieving activity, and antimicrobial activity, and anti-inflammatory activity. So combined with all the things which we are finding with that, so
Yes.
we told the most of the things, 70 to 80% are viral or allergic. So we do not need antibiotics. So sometimes with a mild cough, uh, even if it is used at home, so it will have a anti-inflammatory property with a slightly antibiotic and antimicrobial property and mucolytic. So I'm not saying, let doctor decide should he add any other antipyretic or any other antibiotic. But if it is a mild cough without fever or mild fever, this drug is good enough. So we found it quite good enough, and normally our resistance takes over in rest 2 or 3 days.
Yes. So, sir, that dry ivy leaf extract has mucolytic, bronchospasmolytic activity, antibacterial activity, anti-inflammatory activity, which does provide the benefit, that it is required for cough in children. So, sir, since now children, you also mentioned in the earlier discussion that with medications and combinations, children do not end up completing their course or do not take the medication required till their symptoms subside. So, what are the certain benefits of ivy leaf extract cough syrup in children in terms of patient compliance and adherence?
Yes, uh, the lot of uh, cough syrups which are available. Some has in children Ambrexol, some has Lofenicine. So issue is, some people don't tolerate it, and they start vomiting it and not accepting it. So as far as this anti uh, the plant extract is available, this is not irritating to the child, the acceptability of the child. So compliance of the child is better than the other drugs. And we have to see, depending upon the severity of the cough, which antitussive has to be done. So what efficacy is very, very good. So it elevates the inflammations, liquefies the mucus and relieves the coughing and opens the airways. So it helps in the both ways. So it is less irritating. And my experience is that, and I will like to add feedback from my colleagues, the other doctors or the healthcare worker who are working and treating the patient at the periphery at the district or sub-district level, and definitely we should have feedback from them. But I find it quite effective.
Hmm. Yes. So also, sir, here since you mentioned about it being effective and safe to be used in children, what is the importance of dosing, sir, of IV leaf extract? So with combinations, the dosing also becomes a problem. But is there that a worry that needs to be considered for IV leaf extract cough syrup also when prescribing it to children?
So with the natural powder of IV, so far there are no contraindication. I have seen the literature from India and abroad, and there are no interaction known. It is well tolerated. There are no irritability, and it is not in the if we go to the adolescent who are representing country like us, it is not in the world anti-doping agency list. So on the latter side, so the tolerability is very, very good, and that is why the uh, we have to give in a small dose, and we can give for long. Sometimes you did a cough syrup for long, and child is going to the school, or some of the older children are driving their cycle. They are not allowed to drive the scooter and car otherwise. So we find to be much okay. And our Indian culture also, makes they have a confidence is lot of good herbal products which are already in the market, and they are serving us for many years. So there are a lot of other drugs which we are extracting from the plants and finding it good. So it is easily tolerable, acceptable to the community also.
Yes, so very, correctly mentioned by Sir here that dry leaf extract cough syrup has no interactions with drugs, and also the commonly seen side effects with other medications like drowsiness, headache is not commonly seen with dry leaf extract cough syrup. Commonly, it is not seen at all, and especially it is very can be safely used in children less than 1 year of age, which we previously also discussed. So, sir, in terms of safety parameter, how safe is ivy leaf extract in children?
The first thing is the efficacy, the effectiveness, then the tolerability and the safety, and the whatever the data which is available so far, that it is quite effective and it is safe. So once I said safe, uh, we have seen the overdoses of uh, the drugs which are available in the market given to the children. 2.5 ml may be given as a 5 ml. Half spoon can be taken as 1 teaspoon, and teaspoon sizes are very different in India. So if you even accidentally, if the mothers or the doctors give accidentally higher dose, it doesn't uh, have a much side effect, or it does not causes any effect on the brain or any other part, or because it is a limbic, because most of the antitussive we have seen, they have a side effect on the limbic and on the brain part of it. So that part is not seen, so it is quite safe. And I think with the data available worldwide in India, uh, the Drug Controller General of India, I'm glad to inform and know also that Drug Controller General of India has allowed this drug to be on the OTC. That
Yes.
is the latest. So as lot of drugs are available through the CDC in the American market or the UK market, OTC, and those are the country where most of the drugs are still given up, through the prescription. But a lot of drugs are OTCs. Once it is OTC, that means the safety margins are very, very high, and we should be confident of it.
Yes, very correctly and right the insight shared by Sir here that since it is got the approval to be sold as OTC, it gives a strong support to patients and also to the doctors and parents to understand that there is a lot of safety data to support the use of dry leaf extract cough syrup, especially in children, and that the effectiveness is seen in various indications where cough is a primary symptom. So, sir, I would like to understand, if you could share any of your, clinical experience or personal experience with Prospan for cough in children.
I think yes, I will. The literature which I've gone through, the global rated are good and very good, and up to 95 to 98%, and tolerability and the compliance was found to be good and very good by 99%. And with the drops which are available, it is up to almost 99 to 100%. Adverse events are mild, and in some places they have seen some adverse even in the form of some rash or itches from 1 to 2%. So adverse
Hmm.
events are there, and definitely once I drive a car, there will be accident, and we should be
Hmm.
open and have a data of the adverse events after using the drugs, and companies should come forward and drug controller, and there is a post marketing surveillance which the companies have to do it and submit the data, and that is why they must have submitted, and that was our drug controller has made it the OTC. Uh, my experience is that you need more time with the parents to communicate and tell them the cough, because once there is a cough and the child is taking lot of cough syrups, we have seen the postnatal drip, that because nose get blocked, because my nose is very very small in the children. So what we do is simply put nasal saline drops and give extract like this, like Prospan. So it is very very effective. You don't have to give antitussive, you don't have to
Hmm.
give any strong antitussive, you don't have to give antipyretic, you don't have to give any strong anti-allergic, and they become all right. So again I am saying, it's not the drug which is important, how you use the drug it is important, and to find out the primary doctor is the main source, whether the cough is because of upper respiratory, cough is because of the nose block. You must keep the nose block as small as the child nose, chances of nose block is the more. So preschool age, under 1 year, it is too high. Under 5 years, it are high. As the child grows up, the nose blockage gets relieved. So the more cause of cough is because of the nose block and post nasal drip. The post nasal drip is very very effective, and the relief is very very nice. And similarly, in the other cough, allergic cough and the bronchoallergy, mild allergic, because most of the people, the healthcare delivery person should think when the patients are approaching. The most of the patient, most of the people are coming late, and in there that you have to say that whether you have only give the IV leaf extract along with some preventive antibiotics, or with some other nebulizer or not. So, but we find it quite safe, and as you communicate, make patient confident that you should take less and less of drugs which are anti-sedative, which are not required for the body, because every drug has a side effect, and that's why we find IV leaf extracts to be very very nice.
Great. So, sir, correctly, mentioned, and everybody to know here is extremely important that Ivy leaf extract cough syrup, it has the properties required to take care of the cough in your child, and also that it has the safety and efficacy data to support, and that with the efficacy and safety data to support, it can be given to children without having any worry or a caution in mind. So, sir, any final message that you would like to give the viewers today?
the, I think the one important message which we have to give, that the parent should be educated, because so far still the patient comes to me. I am practicing for last 40 years. Sir, cough syrup de do, khansi ho rahi hai, or they will go to the chemist or they'll buy it from there. So So what type of cough syrup? They think that cough syrup is the remedy to the cough. Cough is symptom, not the cause. So again, stressing that we have to go to cause. Most of the time, the cause is very, very simple, from nose blocker to allergy. And there is no need of any strong cough syrup or a drug. Number one. Number two, there is no need of giving combination, because it will contain one, it will contain chloride, it will contain ammonium chloride, it will contain what. So there will be combination of that, what we call is Ramban. So in India, because a lot of combinations are being allowed and it is being sold by the chemist, so one should go in a very small and a strong way and have a confidence that cough is a symptom. That means something is wrong in the patient. You have to go observe it. If there is no fever, the small drugs can be taken and my body resistance is take over. If there is a fever and distress, then I have to report to a doctor. So when to go a doctor is a very, very important. Which antitussive to be used is very, very important. Don't take any scheduled drug or a sedative antitussive without the prescription of a doctor. So and you should not take it. And if the cough is more than 3 days, you should approach the doctor and use the safest medicine available in the counter for the children. So for children, we need more safety. So safer dose for the children. For adult, I can experiment, but not for the children under 5 years, especially. Anything else you want to add?
Sir, no, so this was perfect, sir, and I would like to thank you for taking out the time and having this discussion, because I understand that there are combinations and medications available, but doctors are always apprehensive to give the medication, especially in children, and there is a lot of distress caused in the parents as well due to the suffering of the child. So here, Prospan or dry bee leaf extract cough syrup takes care of all the symptoms of or all the cough that is caused in the child, and it can also be used safely. So thank you, sir, for sharing your insights and your clinical experience with us. Thank you.
I think I would like to add from the because it is a child health question, you should have more feedback and inputs from the especially doctors, because the India lives in the rural area and the slums. You should have more information and doctors. I think it will be more accepted, and will as the data is showing fantastic from the ivy leaf extract. But the more data from India, such a big country of India, will make you and other people more confident. Thank you very much.
Yes. Thank you. Thank you, sir, for your time. Thank you.